Welcome to ICD-10 Transition, Anticipating the Impact, presented to you by the healthcare people. With ICD-10 transition dates settled, hospitals and providers, anyone covered by HIPAA, are scrambling to update their code sets and continue to do business at the same time. This webinar will cover the key steps to anticipate the impact of the ICD-10 transition and share strategies for preparation. Anticipating the impact, your clinical documentation, ICD-10 coding will increase by about 15 to 20%. Physician time spent on ICD-10 documentation will increase approximately 4%. Coding, the learning curve for coders is about 6 months. Payment, expect delays in reimbursement from healthcare payers. More claims are going to be denied and delayed because of improper coding, thus increasing your AR. Personnel, the top 4 jobs ICD-10 will place in high demand are project managers, data architects, software developers, and coding specialists. And that's a reason to get an early jump on it too, to make sure you can get the staff in place to make you successful with your ICD-10 transition. Your budget, the expenses are going to be significant for all parties, but much greater for those at the 11th hour who have to rush to catch up compared to those who have taken a staged approach. ICD-10 touches almost everything and everyone. It's going to touch your billing, lab, nurses, physicians, all your clinical areas, coding managers, front desk, IT. So due to that, that's the most important reason why you need to have your key stakeholders identified in a steering committee. Start working on getting your steering committee together and make sure that they are cross business units with good representation, with those that can be accountable and help with finishing the tasks that are required to be successful. Communicate. Along with that steering committee, the biggest purpose is to communicate and ensure that everybody understands the big picture and what the ultimate goal for success means. In order to do that, it's important to understand who your executive sponsors are, have project leaders, your IT leads, your HIM leads, and leads in other areas as needed. Dr. Glenn Mitchell had a quote on first steps for synergizing health IT projects. A critical step is the creation of a communications subcommittee to coordinate all communications about each of the interconnected health IT programs. Conflicting messages and unneeded repetition of messages to busy clinicians can be avoided through the implementation and use of this committee. While true, it stops the unneeded repetition of messages to busy clinicians, this will also just help the entire organization not have a lot of repetition of unneeded messages and ensure that a central message is going out with a central goal and focus to be successful. As part of that, a part that seems to be getting left out a lot is project management. It's really important to have a real project manager, somebody who understands what project management is, not just someone that takes notes. They need to be somebody that can help you with identifying all the tasks and tracking those tasks in the right manner. And part of project management is identifying and empowering project leadership, establish concrete timelines, assemble stakeholders and design governance model for the project, organize and structure the rollout strategies and stages, know what those are and define them, know what your change management process is. You've got to have the buy-in of everybody for this. Secure your resources, both financial and human, and that's also part of a project manager. They make sure the budget's there and they understand how many hours they have available with your current staff, or if you need to add additional staff. Provide a reporting and assessment structure that ensures your project stays on track. And part of that, not just the reporting, but then that people read it and understand it. It doesn't just get emailed out and not read. Define the metrics that are needed to measure both the progress and the long-term success of the project. You got to know when you hit success. Everybody needs to know that they were successful and they completed some portion of the project that was important to the bottom line of the organization. This completes the presentation on the first part of anticipating the impact. We also have other webinars on ICD-10 readiness assessment that continues this webinar. We also have successful EMR Go Live webinars with a series of 3 webinars on that. If you have any questions, please feel free to call us. Thank you.